Let's talk a little bit about asthma. What are some of the characteristics of asthma? And then we'll go to COPD.
So asthma is a condition that, first of all, tends to affect people that may be younger, although its onset can be at any age. The symptoms are shortness of breath, wheezing, coughing, and there's usually a strong allergy component to asthma.
So at an early age, and there's frequently allergy that's there, and they have cough and wheeze. How do you make the diagnosis?
So one thing that can be helpful is there's a test called spirometry. And spirometry is a test you do at your doctor's office where you breathe into an apparatus and it really assesses your airflow out of your lungs. And that's one thing about asthma is that generally you're getting air in okay, but sometimes there tends to be an issue getting air out. However,
so does the person feel like they can't get the air out, or they feel like they can't get it in?
It depends, because if their lungs are really tight and their airways are tight, sometimes it can be a restricted feeling, like they can't get the air in.
But the real problem is it's trapped and they can't get the air out.
That's exactly right.
And spirometry, lung studies can give you information on that?
They can. If the person's having symptoms when they do the spirometry, then often it will be abnormal. But the other thing about asthma is it really varies over time. And so it might be that the person does the test on a day when they're not having any symptoms at all and feeling good, and their spirometry could be completely normal.
And other days, if it's really bad, it could look worse than it is?
Absolutely, absolutely.
So how do you tell in the office if it's really bad and you can improve it? What kind of tests do you do?
Well, in the office, I mean, a lot of the diagnosis of asthma is still based on the history and the symptoms. And so if I have somebody who describes a tightness in their chest, if they describe wheezing, a lot of times nighttime symptoms are very common in asthma. In the office, we can do the spirometry, and then we'll have the person do the breathing test, and then we'll have them take an inhaler, and then we'll repeat the breathing test afterward. And if we see a substantial improvement just before and after, that also very much supports the idea of asthma.
Are there certain criteria for so much improvement to establish the diagnosis?
We'd like to see if the airflow started abnormal and we see a 12% increase in the airflow. That really tells us something.
So does everybody does the normal lungs have a tone and you get a little bit of improvement, everybody? Or just asthmatics?
Well, the normal lung has some tone and you might see a little bit of improvement, but really when you're starting to talk about 12% or more, you're really talking about more kind of people with asthma.
So if you do spirometry and then you use a bronchodilator and you get 15% or 12%, does that make the diagnosis?
Not necessarily. There still could be that asthma is not the only lung disease where you can see that happen.
But it's the way you establish asthma. If you don't have any improvement, does that mean you don't have asthma, or does that mean most likely you don't, or it depends on the history and the physical?
Well, it means, it certainly argues against it, but for example, certain medications, if you were already taking them, might make it where you don't get that 12%. And so you really want to look at the entire picture, what the patient tells you, when you listen to their lungs, and then also what the spirometry test says.
Young person, some allergies, a lot at nighttime. Other triggers would be like what? Cold air, warm air, or what?
It's certainly cold air tends to be a trigger. Exercise can be a trigger. Different people have different triggers, and so that's one of the recurrent things about asthma is there's a lot of variability.
Is an infection a trigger frequently?
Certainly, an infection can trigger a flare-up of asthma. It doesn't cause asthma, but it can trigger a flare-up.
And make it worse.
Yep.